many patients complain of difficulty concentrating, or they might say to us, I think I have undiagnosed ADHD. This can be straightforward with children, but a little bit more complicated with adult patients. I am so excited to have Dr. Herman Naftel here with me, a child and adolescent psychiatrist. Herman, what exactly is ADHD?
Michael, great question. ADHD, formerly known as ADD or attention deficit disorder, is attention deficit hyperactivity disorder. That's a neurodevelopmental disorder that presents before age 12. Essentially, what you're looking at is a persistent and pervasive pattern of inattention and or hyperactivity and impulsivity that's interfering with functioning in at least two settings. Most people who have ADHD as a child or adolescent will not have ADHD that interferes with functioning as an adult, but about 30% will.
I think it's important that we understand the diagnostic criteria in the Diagnostic Statistical Manual version 5 or DSM-5. Can you walk me through that exactly?
ADHD can present in several different ways. You can have the primarily inattentive type, you can have the primarily hyperactive or impulsive type, or combined.
And I think you mentioned before that term ADD, should we be discarding that and not using that in our vernacular?
It's pretty much used synonymously, but technically it is now ADHD that we are diagnosing and not ADD.
Got it. Okay. Well, let's walk through, I think first starting with the inattentive type using the DSM-5 criteria. What does that look like?
Okay, great question. So you have a set of symptoms outlined in the DSM, and you need to have 5 or more of these symptoms. Symptoms can include difficulty paying attention, losing items, easily distracted, forgetful, difficulty organizing. People often lose phones or keys or homework or job assignments, computers, etc. Sometimes people don't seem to be listening or paying attention when you're having a conversation with them. It's something that can really impact ability to concentrate in multiple settings.
Okay, so this is the inattentive type. It sounds like these symptoms have to occur for at least 6 months, and you have to have more than 5 of them. What about the hyperactivity side that you talked about?
Okay, so hyperactivity can present in several ways. Again, we're looking at 5 or more symptoms of the many that are described in the DSM. So these include tapping, fidgeting, hyperactivity, leaving seat, can't sit still at a desk for a long time, just feeling restless. Often people will have trouble being quiet or sitting still and can look as if they're on the go or like driven by a motor at all times. There's a lot of talking, sometimes excessive talking or blurting out or trouble taking turns. You might notice that these patients could interrupt you frequently.
Okay. So again, same concept as inattentive in that we've got 5 of these symptoms and for at least 6 months. Is that right?
That's right.
Okay. What other considerations are there? So, right, I know that you have to have these symptoms, but is there other components to making the diagnosis?
Well, we want to see that these did start prior to age 12. So that's key. I think another thing that is key is what is functioning like? If someone is functioning well in all settings, it's hard to make a diagnosis of ADHD. We also want to make sure that these symptoms aren't better explained by other factors or conditions.
Okay, got it. So that's super helpful. So it's symptoms plus these other features. I think one thing that I get a little bit confused about is the tools that we're using to diagnose this, especially in settings where we may not have more advanced testing or maybe other resources like a psychiatrist or a neuropsychologist. How are we making the diagnosis?
Good question again. This is a clinical diagnosis. There is no lab test or imaging or anything else that you can do to get a 100% accurate diagnosis of ADHD.
So like I can't do like a pan scan, like a CT scan from like head to toe, and that's going to give me the answer?
Not to my knowledge.
Okay.
No.
Okay.
No.
Got it.
Not yet.
Okay. So you're saying it's a clinical diagnosis. What are things that we're using to help us in primary care settings to actually make the diagnosis?
So first, what are you seeing? Someone with ADHD, you're going to see, without even asking about these specific symptoms, you're going to see difficulty waiting turns or interrupting or hyperactivity, or maybe they're not paying attention. So you are essentially paying attention to their presentation. There are also scales that you can use that are really helpful, self-report scales that adults use. In children, we're seeing more teacher reports and parent reports. But in adults, we often do rely on family report or report of loved ones or, children sometimes, spouses. That can be incredibly helpful.
So it sounds like collateral can be really important, especially in the adult setting, maybe even a parent of an adult who may be able to reference back to childhood and provide some key features or key history. Outside of the scale that you talked about, are there any other labs or diagnostic tests that we should perform to help with the diagnosis?
In general, probably not. There are cases of medical conditions that can present this way, but I think in general, I don't recommend lab testing.
Got it. And it sounds like it can sort of prolong someone not getting access to treatment if you're trying to rule out every single thing. I think like other things I think about are medications or substance use, or maybe they have maybe even another psychiatric condition that's ongoing. But it sounds like, you were saying before, this is pretty common.
It is pretty common. And so you do want to make sure that it's not anxiety or depression. Both can present with difficulty concentrating. You want to make sure it's not mania, because it's tough to concentrate when in a manic episode. We want to make sure that there aren't substances being used or medications that could alter focus. I think that other things to consider would be hearing difficulty, visual difficulties. But in general, this is a common psychiatric condition that does not require specific tests.
Okay, that's super, super helpful. And you were mentioning scales before. Remind me again, what exact adult scale do you typically use in your practice?
I'll often use a self-report. It's an ADHD self-report scale, the ASRS. I find it to be really helpful in figuring out what symptoms are present prior to treatment. It can help with the diagnosis. It's also pretty helpful for monitoring response to any interventions.
Are there any pitfalls with giving this scale to an adult specifically?
I think so. Any self-report can be inaccurate. Sometimes there's bias. Sometimes there's recall difficulty. But in general, I find that most people are pretty straightforward and honest with their responses on the ASRS.
Got it. And in kind of the work that I do with substance use disorders, I could imagine that someone could over-report with the hope of maybe getting a prescription. I don't know if you've ever seen that in your practice using the scale.
I've seen that a couple times. It's often evident. I think we can look at prescribing practices, look at controlled substance database, and we're looking at functioning. If they're not functioning well and they're reporting these symptoms, I generally believe them.
Okay, got it. So using that scale, being mindful of other reasons that someone might be wanting to get a prescription. I think the question I always come back to, being in primary care myself, is can we actually diagnose this condition, ADHD?
Absolutely, and you should. There aren't enough mental health providers to diagnose ADHD for everyone who has it. The wait lists are very long, and I think that with a little education, you can do a very good job treating ADHD.
Well, you're building up my confidence as we're sitting here
hope
talking
so.
about that, which is great. I think one other thing that comes up a lot that I hear about is online services that provide kind of diagnostic testing or services. I have patients ask about this, particularly quite a bit, because psychiatry can be sometimes expensive for folks, or as you mentioned before, the wait list can be really, really long. What do you think about this?
I agree with you. So yes, we hear about this, but I haven't seen robust evidence that it's more helpful than conversation in a clinical judgment. These tests can be expensive. I think they can be helpful in certain situations. I think a psychologist can be really helpful in ruling out learning disabilities or other cognitive problems that could present similarly to ADHD. But in general, I don't think you need these things.
So don't go straight to the web, essentially.
Probably not.
Okay.
I have not done that.
Okay. So it sounds like you said, simple, maybe not so simple, but history, and really listening to the person in front of you and understanding what's happening is really critical, and that it's a clinical diagnosis.
That's right.
This is Hippo Education.